So at a CAR T-cell meeting, everybody talks about CAR T-cells, but of course there are also bispecific antibodies that are able to link normal T-cells to cancer cells. And in this session, I elaborated on how bispecifics works, what their biology is, and what the difference is to CAR T-cells, which namely is the missing co-stimulatory domain, leading to perhaps less efficacy than CAR T-cells, but also less side effects. So they're kind of perhaps weaker alternatives to CAR T-cells, but they're available off the shelf, so they might be viable treatment options if you need to give treatment fast, or if you have a patient that is not able to receive CAR T-cells due to the condition of the patient. Usually bispecifics, or sometimes bispecifics, are given as a bridging treatment exactly because they are more easily available during the time it takes for the CAR T-cells to be manufactured. And we're always afraid of losing the target on the tumor cells if you treat the patient with the same targeting bispecific than with CAR T-cells. But it's a not very well studied field, so I think further studies are necessary to figure out if this is a good idea or not, although some data are already available and some more are to come.